Is your liver fatty? Don't ignore these 8 warning signs. Do you ever wake up feeling strangely exhausted even after a full night's sleep? Is your skin looking a little dull lately? These seemingly unrelated clues could be your liver silently screaming for help, signaling a hidden danger known as fatty liver disease. Today, we're uncovering 8 often overlooked signs that your liver might be in trouble, so you can take action before it's too late. Let's understand what fatty liver disease is and how it can affect your overall health. Your liver is a powerhouse organ, filtering toxins, processing nutrients, and playing a vital role in digestion. But when excess fat builds up in its cells, it can't function properly. This is called fatty liver disease, and it's more common than you might think. In fact, it affects up to 25% of adults in the United States. Fatty liver disease often doesn't cause noticeable symptoms in its early stages. It's a silent threat, slowly progressing and potentially leading to serious complications like liver failure or liver cancer. So, without further ado, let's dive into the 8 often ignored signs that your liver might be fatty. Let's start with a symptom that might surprise you. Number 8. Yellowing of the skin and eyes. Jaundice. Jaundice is often associated with more advanced liver disease. It's important to note that even mild yellowing can be an early warning sign of fatty liver. This yellowing occurs when bilirubin, a yellow pigment produced by the liver, builds up in the blood. In a healthy liver, bilirubin is processed and excreted, but a fatty liver can struggle with this task. Did you know that up to 70% of individuals with non-alcoholic fatty liver disease experience some degree of jaundice? It's not always obvious, so pay close attention to subtle changes in the whites of your eyes or a slight yellow tinge to your skin. If you notice any yellowing, it's crucial to consult a doctor for further evaluation. Remember, early detection is key to managing and reversing fatty liver disease. Number 7. Itchy skin. While it might seem like a minor annoyance, persistent itching can actually be a sign that your liver is struggling. Your liver is responsible for filtering toxins from your blood, but when it's overloaded with fat, it can't do its job as effectively. This allows toxins to build up in your bloodstream and eventually make their way to your skin, causing irritation and itching. Imagine your skin as a barrier, protecting your body from the outside world. When toxins accumulate, they can disrupt this barrier, leading to inflammation and that all-too-familiar itchy sensation. It's like your body's way of saying, "Hey, something's not right in here." This itching, known as pruritus, can affect your entire body or be localized to specific areas. It can be mild or severe, and it may worsen at night or after a warm shower. While there are many possible causes of itchy skin, including allergies and dry skin, if it's persistent and unexplained, it's worth considering your liver health as a potential factor. If you're experiencing itchy skin, especially if it's accompanied by other symptoms like fatigue or abdominal pain, it's important to consult with your doctor. They can perform tests to assess your liver function and determine if fatty liver disease is contributing to your discomfort. Treating the underlying liver issue is key to resolving the itching. Along with lifestyle changes like a healthy diet and exercise, your doctor may recommend medications or other therapies to manage the itching and improve your overall liver health. Number 6. Abdominal pain. It's easy to brush off a little tummy trouble. Persistent pain or discomfort in the upper right abdomen could be your liver crying out for attention. Your liver is located on the right side of your body, just below your rib cage. As fat accumulates in the liver, it can become enlarged, causing pressure and pain in that area. This discomfort can range from a dull ache to a sharp stabbing sensation, and it may worsen after meals or when lying down. Sometimes this pain can be mistaken for indigestion or a muscle strain, but if it's persistent or accompanied by other symptoms like fatigue or jaundice, it's important to get it checked out. Fatty liver disease can progress to more serious conditions like inflammation and scarring of the liver, cirrhosis, which can cause significant pain and discomfort. It's worth noting that only about 20% of people with fatty liver experience this symptom, but it's a significant one nonetheless. If you're experiencing unexplained abdominal pain, especially in the upper right quadrant, don't dismiss it. It could be your liver trying to get your attention. Consult with a healthcare professional to rule out other potential causes and get a proper diagnosis. While abdominal pain might be a direct message from your liver, let's explore another sign that's a bit more subtle. Number 5. Fatigue and weakness. Feeling unusually tired or weak, even after getting enough sleep, can be a subtle sign of a struggling liver. When your liver isn't functioning optimally due to fat accumulation, it can't efficiently process toxins and nutrients, leading to a buildup of waste products in your bloodstream. This can leave you feeling drained and lacking energy. Think of your liver like a filter for your body. When it's clogged with fat, it can't filter out impurities as effectively, leaving you feeling sluggish and run down. This fatigue can be persistent and interfere with your daily activities, making it difficult to get through the day without feeling exhausted. If you're constantly feeling tired for no apparent reason, and other causes like lack of sleep or stress have been ruled out, it's worth considering your liver health as a potential factor. A simple blood test can assess your liver function and determine if fatty liver disease is contributing to your fatigue. Number 4. Unexplained weight gain or difficulty losing weight. While many factors can contribute to weight fluctuations, a fatty liver can throw a wrench in your metabolism and make it harder to manage your weight. When your liver is struggling, it can affect your metabolism and how your body processes food. Your liver is a metabolic hub responsible for processing fats and carbohydrates. When it's clogged with fat, it can't perform these functions efficiently, leading to a cascade of metabolic problems. One of these problems is insulin resistance, where your body's cells become less responsive to insulin, the hormone that helps regulate blood sugar levels. Insulin resistance not only makes it harder to lose weight, but it can also lead to increased fat storage, especially in the liver. This creates a vicious cycle, where a fatty liver contributes to insulin resistance, which in turn exacerbates fatty liver disease. If you're struggling to shed those extra pounds despite your best efforts, or if you're noticing unexplained weight gain, it's important to consider your liver health as a potential factor. A fatty liver can disrupt your metabolism and make weight management an uphill battle. Of course, weight gain can have many causes, but if it's accompanied by other signs of liver trouble, it's crucial to consult with your doctor. They can assess your liver function and recommend lifestyle changes or treatments to address any underlying issues. Number 3. Brain fog and difficulty concentrating. You may think that brain fog and forgetfulness are just a normal part of getting older, but they could also be a sign of fatty liver disease. Your liver plays a crucial role in filtering toxins from your bloodstream, including ammonia, a byproduct of protein digestion. When your liver is overloaded with fat, it struggles to process ammonia efficiently. As a result, ammonia can build up and travel to your brain, interfering with its normal function. This can lead to brain fog, a feeling of mental haziness or confusion. You might find it harder to focus, remember things, or make decisions. Some people even describe it as a fuzzy feeling in their head. It's like trying to think through a dense fog, making mental tasks more challenging than usual. If you're experiencing unexplained brain fog or difficulty concentrating, especially if it's accompanied by other symptoms like fatigue, it's worth considering your liver health as a potential culprit. Addressing fatty liver disease through lifestyle changes like a healthy diet and exercise can often improve cognitive function and alleviate brain fog. Number 2. Nail changes. Healthy nails are typically smooth, pink, and firm. However, when your liver isn't functioning properly due to fatty liver disease, you might notice changes in your nails. These can include white lines or bands across the nails known as Merkes nails, clubbing that is thickening and rounding of the nails, or even a yellowish discoloration. These nail changes occur because your liver is responsible for processing and distributing nutrients throughout your body. When it's struggling, it can affect the production of proteins and other substances that are essential for healthy nail growth. For example, a protein called albumin, which is made by the liver, plays a role in maintaining the structure and strength of your nails. Low albumin levels, often seen in advanced stages of fatty liver disease, can lead to brittle, weak nails that are prone to breakage. Similarly, iron deficiency, which can occur with liver problems, can cause your nails to become spoon-shaped or concave. This is because iron is needed to produce hemoglobin, the protein in red blood cells that carries oxygen throughout your body. While nail changes can have various causes, if you're experiencing them alongside other symptoms like fatigue or abdominal pain, it's important to consider your liver health. A simple blood test can check your liver function and determine if fatty liver disease is contributing to these nail abnormalities. Number 1. Enlarged blood vessel. While not visible to the naked eye, these swollen veins can be a serious indication of underlying liver damage. These enlarged blood vessels, known as varices, typically develop in the esophagus and stomach. They occur due to increased pressure in the portal vein, the major blood vessel that carries blood from the digestive organs to the liver. When a fatty liver becomes inflamed or scarred, it can obstruct blood flow through the portal vein, causing it to back up and put pressure on the smaller veins. Think of it like a traffic jam in your veins. When the main highway, portal vein, is blocked, the smaller roads, esophageal and stomach veins, become congested and start to bulge. These varices are fragile and prone to bleeding, which can be a life-threatening emergency. Symptoms of varices can include vomiting blood, black tarry stools, or even blood in your urine. However, in some cases, there may be no noticeable symptoms until a variceal bleed occurs. That's why it's crucial to be aware of this potential sign and seek medical attention if you have any concerns. A procedure where a thin tube with a camera is inserted into your esophagus and stomach can help diagnose varices. If detected early, there are treatments available to reduce the risk of bleeding and manage the underlying liver disease. Remember, your liver is a resilient organ, and with the right care, it can often bounce back from damage. By recognizing these warning signs and taking action, you can protect your liver and improve your overall health. Your liver health is in your hands. So, make healthy choices, listen to your body, and don't be afraid to ask for help when you need it. Stay informed, stay proactive, and remember, you're not alone in this journey.